Within the Lymphoma Working Party, we've got many different investigators from around the world who are performing various studies. One of the sort of key areas that we've been studying recently is the efficacy and outcome of haplo-identical transplantation. So that's half-matched family donor used as your donor source. So haplo-identical transplantation to achieve disease responses and control in various types of lymphoma. And results from our registry-based studies suggest that actually haplo-identical transplantation may be a very effective strategy to obtain disease control, and possibly as effective as more conventional donor sources such as matched sibling and matched unrelated donor transplants. So this is really a very exciting area of transplantation. And one of the great things about it is that literally every single patient will have at least one, possibly two or three or maybe four haplo-identical donors that are immediately available to use, which is good news. Some of the other areas that the Lymphoma Working Party has been doing a lot of work in is on transplantation in follicular lymphoma, and we've recently been updating the EBMT LYM1 trial, and we've got very exciting data now with very long follow-up from that study showing that autologous stem cell transplantation in follicular lymphoma may be a curative procedure, which I think is going to really challenge a lot of the current perceptions about autografting in that disease. So these are sort of just some examples of some of the studies that we're performing in the Lymphoma Working Party. We're also able to study rare diseases because we have a huge database collected from patients transplanted around the world. And so we're actually able to get reasonable numbers of patients with rare types of lymphoma and describe their outcomes as well. So it's one of the sort of advantages of the EBMT registry. The Working Party, I would say, is a very open, inclusive group. We're sort of very welcome to all new proposals from people, whichever transplant centre they're working in. So they should come along and get in contact either with myself or with Sylvie Montoto, our chair, to discuss the proposals so we can look to refine them and then take them forward as a study. And in addition to that, we run a number of education courses, and I'd highly encourage not just juniors, but also people who are in qualified consultants in specialist posts to come along to our training course, because it provides an excellent update on the role of transplantation in lymphoma.